So we're going to walk through sort of what is an HSA. So when we think about the HSA, it really is the combination of a high deductible medical plan sort of married to a tax-free health savings account. And it's those two components that make up what we call an HSA medical plan. The health savings account itself is a triple tax-free account that you can put money of your own in, your employer can put money in, or a third party can put money in. And it really is kind of the holy grail of taxation. That health savings account, any money that goes in tax-free, grows tax-free, and comes out tax-free for qualified medical expenses. The idea of the HSA is really to give control back to the individual, under the idea that if we give you the money to spend, you'll spend it more wisely, because if you don't spend it, you simply roll that over to the next year and the next year and the next year. So there's no use it or lose it provision. That money just rolls over year after year after year. And we really think that it provides incentives to make value-based medical decisions. So if you have that money, if you don't use it, or if you spend it wisely, you roll it over year after year. We think people make better decisions if they're given that opportunity. So with the high deductible health plan, one of the big questions that we get generally is, what's covered? Is it different than the HSA? Than the HMO. What's covered in the underlying plan is exactly the same. So preventive care is covered at 100%, hospitalization, prescription drugs, crutches, braces, all types of things like that. All the same things are covered in the HSA that are covered in the HMO. It's just how it's paid for is a little bit different. In the HMO, you pay copays. In the HSA, there are no copays, but you would pay up to the deductible maximum. The network is all the same doctors and hospitals that you're using now in the HMO. That doesn't change. There is one slight adjustment to the network outside of the New England area. Right now, if you're outside the New England area, you don't have coverage unless you are part of the away from home plan. And that's a process in the HMO where you can apply for that and basically be put into an HMO plan in a different state. Let's pick Colorado, for instance. Starting July 1st, the HSA, because of some changes at Anthem, with the HSA, we'll be able to layer on the National Blue Cross Anthem PPO network on top of the New England HSA network that we currently use. So what that means for members is that if you have a split family, maybe part of the family is in New Hampshire, part of the family is in California, you can choose providers in whatever area of the state you are, as long as they're an Anthem Blue Cross provider. And you can use that provider just the same as you would if you were here in the New England area. So huge change to the plan, huge advantage, and I think it will be well received by folks, particularly those people that have, the college student who needs regular services, or maybe a young adult that's on their own but still on your health plan, that 23, 24, 25-year-old. So this is really the one change in the network, and it's a pretty significant enhancement. So what services are covered in full? Well, it's really the same services that are covered in full in the HMO. Any preventive services, and preventive services, there's a list of them that's really been put together by the federal government and health insurance carriers. And it's things like routine physicals, screenings, cancer screenings, mammographies, pap smears, immunizations, contraceptives, routine vision exams. So those are all covered at 100% in the HMO, in the point of service, or in the HSA program. Everything else is subject to the deductible. And I always find the easiest way to explain a deductible is to ask people to think about your auto insurance. When you think about your auto insurance, you know that you always have a deductible. It might be $250, might be $500, might be $1,000. So let's say that you have a auto insurance plan with a $500 deductible. You get into a car accident and the accident costs $2,000 to fix your car. The insurance company is going to expect you to pay the first $500, the deductible, and then they'll pay 100% of the costs after that, or the $1,500 to repair your car. When you think about that auto insurance, if you take your deductible from $500 and you increase it to $1,000, what happens to your premium? Increase your deductible, your premium goes down because you're taking on more risk. The insurance company is taking on less risk, and therefore they have a reduction in premium. Health insurance works exactly the same way. And that's one of the fundamental pieces of the HSA plan. We have a high deductible plan. We've increased that deductible from your current $250 up to $2,000 for a single plan, or $4,000 for a two-person or family plan. As we increase that deductible, the premium goes down. We take that difference, and that's what we use to fund the health savings account, that triple tax-free account that's in your name that you can control and that you can take with you if you were to ever leave the city of Nashua. So what's subject to that deductible? Really everything but preventive care. So regular doctor's office visits, specialists, prescriptions, labs, x-rays, hospital, inpatient, outpatient surgery, behavioral health care, everything but preventive care is subject to that deductible. Once you hit that deductible of $2,000 for a single or $4,000 for a two-person or family, the plan pays 100% of the remaining costs for the rest of the year. But we give you a little bit of help with that deductible, and that's in the form of the HSA contribution. So by virtue of increasing the deductible, we've lowered the premium. We take that savings, which is about $1,500 for a single plan, or $3,000 for a two-person or family plan, and the city contributes that to your HSA. So when you think about this plan in totality, you get $1,500 put into your HSA that you can use to pay deductible expenses. Your plan deductible is $2,000. So your worst case in the HSA is $500 out of your pocket. Now, when you compare that to what you might pay in copays and deductibles and out-of-pocket expenses in your HMO, that's probably pretty favorable. If you think of you're someone who, hey, I'm pretty healthy, but I take a prescription drug and my copay for that is $50 per month. Well, that's $600 over the course of the year. So you would have been better off in the HSA. In the family plan, $3,000 goes into your HSA, $4,000 is your deductible. So your worst case out of pocket is $1,000 for a two-person or family plan. Again, after you meet your deductible, the plan pays 100% of qualified in-network expenses for the remainder of the year. Contributions to the HSA, they're not all made upfront. Actually, they are now. In the future, they will be 50% will be paid in July, and the remaining 50% in October. Now, one of the reasons that we do that is to make sure that if someone were to leave the city in August or September, that money goes with you. So we want to make sure that all the money isn't necessarily there up front, because if someone leaves, you have to replace that employee. However, we also recognize that people may have a hardship. You may just be unfortunate that, the third week of July, your child, has an accident, breaks a bone, requires surgery, they're in the hospital, and all of a sudden you've got a $10,000 expense. Well, that's certainly going to go through your family deductible of $4,000. And you've only got $1,500 in your HSA because it's still July. So if you have a situation where you've exceeded the contribution in your HSA from that first payment in July, the city will accelerate the HSA contribution, really that other $1,500, if you can just bring in proof of the expense. So your explanation of benefits or bill from the provider that says, hey, now I owe $4,000 on my family plan. I've only got $1,500 in my HSA. We'd like the city to accelerate that additional $1,500 and pay that in August instead of October. The city's willing to do that knowing that, you know, those hardships may happen, won't happen all that often, but they will happen here and there. So when we look at the contributions to the plan, and we've got some good news here. On the screen, you see the rates for 2020. Well, these will also be the rates for 2021. So there will not be a rate increase this year. So the rates that were effective July of 2020, those will be the same rates effective at the renewal in July of 2021. Had you been on the HSA plan, or if you were on the HSA plan now, what you see in front of you is the annual cost out of your paycheck for the HSA versus the HMO for single, two-person, or family coverage. So you'll see that the HSA is about $387 less out of your paycheck than the HMO. Two-person plan is $791 less. Family plan is $1,262 less. So what we've been saying for the last number of years is we would encourage you to take that savings, because you're already paying it now, and contribute that to your HSA. If you do it through payroll deduction, that money goes in free of income tax and payroll tax. So Medicare, that basically the roughly 6% or so. Medicaid always gets paid in, but you save yourself probably somewhere in the range of 25% or so by doing it through payroll deduction. Two-person plan, you could put 791 in, so your worst case scenario would be winnowed down to about $200. In the family plan, you'd actually save $1,262 out of your paycheck, which is more than that $1,000 of risk that you had in the, between what the city gives you, the $3,000, and the $4,000 deductible, which is your liability. So makes an awful lot of sense. The HSA, in my opinion, is a better plan, but it's a little bit less costly. If we look to 2021 and the proposal that's in front of the union of moving the HMO plan from a $250 deductible to a $1,500 deductible, that changes the equation a little bit, right? Because as we talked about before, as we increase the deductible, the premium goes down. And you can certainly see that in this example. So we've increased the HMO deductible from $250 to $1,500. The premium has gone down pretty significantly. So when you look at the previous slide, the premium for the HMO, the current HMO with a $250 deductible, is $2,400 a year out of your paycheck for a single. The $1,500 deductible is only $1,900 out of your paycheck. But you're taking on more risk, right? You have more liability, $1,500 if you're hospitalized or have an outpatient surgery. So that plan is less rich than the HMO and less costly. So if you do move to the $1,500 HMO, you'll need to make a decision. Do I stay on the HMO and I have that risk of $1,500? Or do I go to the HSA and it's going to be a little bit more out of my paycheck? Again, because the HMO premium has gone down because of the higher deductible. And really, each individual will have to make that decision for themselves and their family and think about how they use their health care and how you'll be better off. Now, one way to help you make that decision is on the Anthem website. If you've set up your profile, so you have your username and password, you can actually go in and see 24 months worth of claims. So you can see what you've had for claims, what the cost of those was, what you've paid in co-pays and deductibles. And that might help you make your decision on, hey, is the HSA better for me or is the HMO better? So let's walk through a couple examples of how it would work in the HSA, and you'll see how it differs from the HMO. So we've got Carol Lewis. She's a single person with the Anthem HSA. If you see the blue bubble, preventive care is covered at 100%. The HSA contribution, she gets $1,500 from her employer. And Carol has decided to put $2,000 of her own money into the program, and she's doing that through payroll deduction. So she's saving the taxes, call it $500 or so in taxes on that $2,000 employee contribution. Her annual deductible is $2,000, and that obviously can be paid from the HSA. And then she has her traditional coverage after she's paid her deductible. So she's got, if we look on the left side, year one, $3,500 in her HSA. She has some expenses over the course of the year. Not a lot. She has her well woman preventive exam. Cost of that, including all the lab work and everything, is about $350. She does have a prescription drug that she takes over the course of the year. It costs about $300. So she has $650 in total expenses. This is probably a 20 to 30% of the population in any given year is going to have expenses less than $1,000. So this is not a terribly unusual example. So she has her non-preventive expenses, those prescription drugs, of $300. She needs to decide how to pay for those. And she chooses to pay for them out of her HSA account. And at the point of service at the pharmacy, she uses her debit card. The $300 comes out, and probably over the course of the year, $300 comes out, and she rolls over $3,200. Next July, she gets half of her contribution, so she gets $750. And then again in October, she gets another $750. So by the time she's through the end of October, she's got $4,700 in her HSA, but her deductible is still just $2,000. So you'll see that, and we see this with clients all over the place, is that your HSA balance can really accumulate quickly. Let's look at the Wilson family. So family coverage in the HSA, preventive care, again, is covered at 100%. Their employer is putting $3,000 into their HSA, so that's the employer contribution. And the Wilsons have decided that they are not going to put any of their own money into the HSA, which is completely fine. They don't have to, it's completely optional. They have their annual deductible for the family of $4,000, and that can be paid through the HSA. And then they have their traditional healthcare coverage, 100% coverage after that deductible is met for in-network benefits, or 70% coverage for out-of-network benefits. And remember, in the HMO, you just have in-network benefits. Out-of-network is not covered. So you have the health savings account balance of $3,000, and then they have some expenses. They're doing the right thing here. They have their preventive exams, $1,400 for the whole family. Those are covered at 100%, no cost to the Wilsons. They've got some prescription drugs, about $900 worth. And then they have the unfortunate situation of a hospitalization and surgery. That surgery is $14,300. So obviously more than the $4,000, so that kind of blows right through the deductible. And then they have physical therapy after that surgery for about $600. So their non-preventive expenses are $15,800. Again, far more than the $4,000. So they would be responsible for the first $4,000, and then the plan covers 100% anything above that $4,000. So when the bills come due, they pay the first $3,000 of the bill out of their HSA, and that taps out the HSA. There's no more money left in there. So they need to come up with $1,000 of their own. So they have a choice here. Because they haven't put money into the HSA, there isn't that additional $1,000 in there. So they can pay the doctor directly, but the best way for them to pay the doctor would be to put $1,000 into their HSA. And then from the HSA, whether they use online payment or debit card, but from the HSA account, they then pay the doctor or the hospital that $1,000. The reason that they would want to put the money into the HSA and then pay the doctor is because any money that goes into the HSA goes in tax-free. So if they just wrote a check to their HSA, they would claim that on their tax return. It would reduce their total income by whatever was put into the HSA, in this case, $1,000. But the better way to do it would be to go to HR or payroll and say, hey, I want to contribute $1,000 to my HSA. I need to do it relatively quickly because I have this bill that's outstanding. So can you take out $250 a week for the next, or pay period for the next 4 pay periods, or $500 per pay period, whatever amount you need to get that done within a reasonable amount of time. By doing that, you avoid payroll taxes and you avoid federal income taxes. So this is where you kind of see that flexibility of the HSA. Unlike a flexible spending account where you need to make a choice in May for the following year of how much you might want to put in there, the HSA, you can make a choice whenever you want to put money into the HSA, so it gives you that flexibility. So because the HSA is triple tax-free and it's the only account like that, the IRS and the US Department of Treasury have a little bit to say about it. And there are some rules around who can participate in an HSA, what circumstances. So first and foremost, to open an HSA and contribute to it, you need to be enrolled in a qualified high deductible health plan. The health plan we offer, the City of Nashua offers, is a qualified high deductible health plan. The other big caveat is you can't be covered under another person's health plan and contribute to your HSA. So for example, I have an HSA through my employer. I contribute to that HSA, my employer makes a small contribution to the HSA. I could not contribute to the HSA, or my employer could not contribute on my behalf if I was covered, let's say, on my wife's HMO. That's a no-no. And it really does make sense. The whole idea of this is the federal government is giving you this tax advantage so that you'll save money towards your health care. But at the end of the day, this whole program is a health insurance program. So the dollars that are in that health savings account are meant to pay your deductible. And if you can save money in that over time and by controlling your healthcare expenses, that money can grow. You have to be a resident of the US, not a resident of Puerto Rico or American Samoa. I don't think we have any issues there. Can't be enrolled in Medicare because that's other coverage. Cannot be claimed as a dependent on another individual's tax return, and can't be active military because, again, that comes along with health insurance coverage. Now, if you are approaching Medicare eligibility, age 65, and you're saying, hey, you know what, I'm going to work till I'm 68. You can defer Medicare, and you may or may not know that Medicare Part A happens automatically. Medicare Part B and Part D you have to apply for and you pay for, but Medicare Part A happens automatically. So if you're thinking, I'm getting close to 65, I want to continue to work, preferably 6 months prior to turning 65, you would want to speak to the Social Security office and let them know that you want to defer your Medicare until such time as you retire because you want to be on an HSA plan. They'll know what you're talking about. If this was 7, 8 years ago, it might be a different conversation, but this is fairly common practice now. How do you get the most out of your health plan? Whenever we have the opportunity to get in front of people and do a presentation, we really want to give people some sort of best practices. And there is, and you may or may not be aware of it, there is tremendous variation in the cost of services in healthcare with no discernible difference in quality. We're going to talk a little bit more about Smart Shopper in the next few slides, but really one of the things that we try to impress upon people is use things like the Anthem website to search for cost savers. Anthem's Live Health Online, that is their telehealth program where you can have a FaceTime or Skype type of visit with a provider for minor situations. You know, maybe it's a strep throat or a rash or something pretty minor that you don't, you know, the doctor doesn't have to sort of put his hands on it. You can have that online visit with the provider. If you use Anthem's Live Health Online, the cost is very low. It's about $40 or $50. You can shop around for the best pricing and discounts on prescription medications. Believe it or not, if I go to Rite Aid, right across the street from my office here, or I go to Rite Aid on the other end of town, there's going to be a different price for the same medication. GoodRx is an application that we like that tells you where's the lowest cost place to get that prescription drug that I'm taking, and then there may be some different coupons. You can obviously choose generic drugs versus brand name drugs when they're available. And you can take advantage of pharmacy prescription cards. Over the years of working with municipalities and working with literally hundreds of people on the HSA, people have come up to me in meetings and said, hey, I joined this Hannaford prescription card club, or I joined one at CVS. You can take advantage of those prescription programs. One note, you're usually getting that deeply discounted prescription through that pharmacy program But that's outside of your insurance, meaning that you're not submitting a claim and running through that insurance. So if you're not submitting a claim, there's no way for that to reduce your deductible. But we've seen circumstances where someone was paying $230 for a drug, and through the Hannaford prescription program, they were getting that drug for $30 a month instead of $230. So it was worth it for them to go outside of the benefit program. Smart Shopper, obviously a great way to save, and we'll talk a little bit more about that. So how are claims paid? This is going to be a little bit different than the HMO. The HMO insurance companies made it really, really easy. You walk in, you show your card, you pay your copay, $20, $30, whatever it may be, and you're kind of on your way. The HSA is a little bit different. You're going to have to do a little bit of work, but it really is just a little bit of work. At the pharmacy, it's going to work very much the same as it does now. You show them your Anthem card. The pharmacy has a direct link into the Anthem claim system, so they can see whether you've met your deductible or not. If you've met your deductible, prescription cost is $100. Doesn't matter. You met your deductible. It's covered at 100%. There's no charge to you at the pharmacy. If you go into the pharmacy and you haven't met your deductible, and let's say the wholesale cost of the drug was $130, and Anthem's discounted rate for this drug was $100, the pharmacist will charge you $100 right there at the pharmacy, because they can see where you are in your deductible. They can see that you haven't met it. You simply take your debit card, you swipe your debit card, or use the chip, and you pay the $100 right there at the pharmacy. Your HSA balance is reduced by $100. Your deductible is also reduced by $100. And you can go right onto the Anthem website. You can see that transaction generally within 24 to 48 hours and see the change in your balances. At the doctor's office or hospital, it's a little bit different. And I've been on an HSA for years. When I go into the doctor's office, they don't charge me anything when I'm walking in. They don't charge me anything when I'm walking out. They don't have that direct link into the Anthem system. And quite frankly, they don't know exactly what they're going to get reimbursed for that office visit. So it really has to run through the Anthem claim system. And the way that it works is quite simple. You go in and see the doctor sends a bill to Anthem. The Anthem system looks at it and says, okay, Tom's met his deductible. They send what's called an explanation of benefits to me that says, Tom, you went to the doctor on this date. The doctor billed $250, or they charged $250. What was allowed based on our negotiations was $140. You haven't met your deductible, expect a bill from the doctor for $140. The doctor gets a very similar statement that says, hey, you billed $250, $140 was allowed, Tom hasn't met his deductible, send him a bill. And this all happens within, probably a couple weeks. It's typically what I see. I get something from either Anthem or the doctor within roughly a week or so. I match those two up. I have the bill. I can either pay the bill online to the doctor, or I can take my debit card and just write the debit card information, mail it back to the doctor, and I'm done. I can go online, see that my balance was reduced by that $140. My deductible was reduced by that $140. So that's really the process. You can order a checkbook and pay using a checkbook. Not many people do that. It seems to be that people either use their debit card to pay the bill, or they pay the bills online. So let's talk a little bit about Smart Shopper. I actually love this slide because I think it really nails it. Where you park your car or where you go has a tremendous impact on what you pay. So when we started Smart Shopper, we started looking at the variation in cost of services with really no difference in quality. And so Smart Shopper, which is now in 35 states, I believe, was actually founded and started out of a discussion at City Hall in Manchester, New Hampshire, where we met with Anthem and the current mayor, or the mayor at that time, excuse me, and we were talking about this variation of cost and trying to figure out, how do we deal with that? And what we were looking at, I don't know why we were looking at this specific procedure, but we were looking at colonoscopy. And we found that within 10 miles of City Hall, the cost for the colonoscopy, I think, ranged from about $4,300 down to $1,600 with the same provider, with the same doctor. Just depended which facility you went to have that colonoscopy done. So out of that was born Smart Shopper. And the idea was we wanted people to be able to either go online or pick up a phone and get the information on what's the most efficient provider, what's the low cost provider for this particular service. So the way that it works is a doctor recommends a service, and there are about 60 or so that are covered under the Smart Shopper program. They recommend the service. I, as the individual, can choose to shop online or to make a phone call or to do nothing. But if I do shop through Smart Shopper, and let's say I call the personal assistant, they will say, okay, well, Tom, you need an MRI. Your doctors recommend that you go to XYZ hospital. If you go to the independent center, Dairy Imaging, for instance, that's the low cost provider, and you'll earn an incentive for going to that low cost provider. I then have a choice. I can say, you know what, that sounds fine to me. I'd like to earn the incentive and like to reduce the cost for the health plan, because I, of course, pay a portion of that. I can make that decision. The personal assistant can keep me on the line and do a three-way call to change my appointment. Everything's done right there. I go and I have the service. About 4 to 6 weeks later, a check arrives in the mail. I can then take that money and drop it into my bank account, or I can use that money and put that right into the HSA, making that money tax-free. Just a little bit more on the personal assistant. I like the fact that people can go online and shop, but I also like the fact that people can just plop that 800 number into their phone, and even right at the doctor's office, they can make that call and find out what the low-cost provider is. And remember, all of these providers, they're all in the Anthem network. They're all credentialed every 2 years. So it's not like you're going to a subpar provider. It's just that providers will have very different pricing for different services. And there's no provider that's the least expensive for every service or even half the services. It really changes by the different service that's provided. So you can use the personal assistant. You can call Monday through Thursday, 8 to 8, or Friday, 8 to 6. Again, they'll work with you, and if you need to reschedule your appointment, they're there on sort of a concierge basis just to help you out. Here's just a sample of some of the more popular services where people use Smart Shopper. Things like colonoscopies that we talked about, CAT scans, knee arthroscopy, mammography, MRI, and so on. You'll notice that many of them say, or actually in this, many of them say up to $250 or $150. When we started the Smart Shopper program, we really focused on what's the low cost provider, and that's where you would earn an incentive. What we found over time was, well, maybe somebody didn't want to travel 20 or 25 minutes to the low cost provider, but they would travel 10 or 15 minutes to a sort of medium tier provider. So we started to, where it was appropriate, we started to tier the incentives. So if you went to the lowest cost provider, you earned the highest incentive. If you went to a mid-range provider, there was still savings for the plan, so you still earned an incentive, but it was just a little bit less. So just trying to keep people involved and control costs the best we can for the health plan and its members. So here's a quick example of Smart Shopper. So someone has an injury, they go to the doctor, and the doctor recommends an MRI. That individual calls Smart Shopper or shops online. They're directed to the low-cost provider, and they say, yeah, that's fine. I'm happy to go to that provider. They earn an incentive of $150. Based on that MRI, they need a knee arthroscopy. Again, they shop with Smart Shopper either online or call. They go to the low-cost provider, and in this case, it's probably you're doing it with the same surgeon, you're just doing it in a different facility, probably an ambulatory surgical facility rather than in a hospital surgery suite. You earn the $250 for going to the low-cost or recommended provider. After the surgery, you need physical therapy. Again, you call or shop at Smart Shopper. You go to the low-cost provider and you earn another $150 incentive. So in this situation, an unfortunate injury or accident, but the member is able to earn about $550 by using Smart Shopper. Money that they can take and put into their HSA, so it's tax-free, and then they can use that to pay towards their deductible. The HSA has some limits to it. Again, going back to the IRS, they have some controls over it. So they're basically saying, hey, you know, a wealthy person can't dump, you know, $40,000 or $50,000 a year, and they put a cap on how much can be contributed each year, and that's a cap on how much that can be contributed by all sources. So between your employer, yourself. If you had a child with an HSA, you could make a contribution to your child's HSA. So by all means, the maximum that can go into a single HSA in a year is $3,600. Family coverage is $7,200. There is an exception if you're age 55 plus. You can do an additional $1,000 sort of catch-up contribution into your HSA if you choose, much like you can in your 401k once you're over age 50. These numbers increase a little bit each year with inflation. Over the last number of years, we've seen the single go up by about $50 a year and the family go up by about $100 a year. This is the maximum that you can contribute each year into your HSA. There is no maximum of the total value of the HSA, so it can accumulate to an unlimited number. Some of the things that you can use the HSA for. So certainly qualified expenses, and these are the same expenses that you can use flexible spending account or FSA money on. And you can Google, you know, what can I use my HSA for? And it'll come right up on a Google search. But anything associated with your health plan, so doctor's visits, lab tests, prescriptions, emergency, so your deductible expenses. But then outside of your medical plan, you can use it for dental expenses, braces, you can use it for eye exams, glasses, contacts. Remember though, if I've got $4,000 in my HSA and I've got a $4,000 deductible, and I take $2,000 out of my medical HSA and I use that for my child's braces, I've just reduced my HSA from $4,000 down to $2,000, right? But my deductible still remains $4,000 because dental is not a medical expense and therefore wouldn't lower my medical deductible. Things you can't use HSA dollars for, cosmetic procedures, things that are not covered by your medical plan, over-the-counter medications, teeth whitening, things like that. So last slide, just giving people a little bit of a look at what I think many of us already know, the compounding factor of money. So if you get into the HSA early, you start contributing a little extra money to it, that money will grow very, very quickly. Once you reach age 65, you can use your money anywhere along the line, you can use your money tax-free from qualified medical expenses. But once you reach age 65, you can use your HSA dollars for anything that you want. If you use it for non-medical expenses, you would simply pay ordinary income tax based on your current tax rate. So if you're 67 and you use, you know, $2,000 out of your HSA for a home repair, you can do that. You'll just pay taxes on that additional $2,000. You'll basically add that $2,000 to your taxable income. So very flexible for you. It's here when you need it during your active working years, in your retirement years. It's always there for your health care, and it can be transitioned to a beneficiary. Again, if you leave the city of Nashua, the HSA goes with you. It's yours, you take it with you, and you can always use it at any point in your life. So that was all we had for the presentation. Happy to take any questions that you have, or if anybody put questions into the chat, Kim or maybe someone else can read those off. But please, if any questions, we'd love to hear them from you, and I think everyone benefits from questions that are asked. If you should happen to have a question and you want to email HR, we'll certainly work hard to get those questions answered to you via email. We do have a few more presentations set up, so if you felt like something pops up into your head, tomorrow or the next day, you can certainly join another presentation and ask your question.
Tom, does Benefit Wallet provide any investment options?
Yes, so the HSA vendor will provide mutual fund options. So once you have $1,000 in your account, you'll have a choice of, I think it's about 15 or 20 different mutual funds that you can invest that money in. Okay, well, thank you very much for your time and attention. And as I said, if you want to join another meeting, we'd be happy to have you. Or if you want to let your coworkers know that we're holding a few more, that would be great. So thank you very much. Enjoy the rest of the day.
Thank you.